Well, with summer on the way, it's those of us with some stubborn pigmentation that need to be more wary that their condition doesn't worsen. Here to give us her expert advice on the causes and treatments for those stubborn dark spots is Dr. Frances Patsillas. Morning, Dr. Frances.
Good morning, Carly.
Tell me, what is stubborn pigmentation?
Well, the other name for it is melasma, and it's not freckles and it's not age-related brownness that you can get with sun damage and age. It's different. It's a browny grey pigmentation that you get across the cheeks and nose, but sometimes other areas as well. And it gets worse in the summer, better in the winter. Now, what happens is that the sufferers find it very difficult to get rid of, and it causes quite a lot of misery. And what we try and get through to people is that it's something that you really have to learn to control.
So who does it affect the most?
You know, more than 50% of women get this during pregnancy, and it's called the mask of pregnancy. Up to 30% of women taking the contraceptive pill, and it tends to occur in darker skins, my colour and darker.
And what causes it or influences it?
Well, it's obviously genetic and race and skin type, as I mentioned, sun exposure, but what's important that is tricky is that it's internal inflammation and health issues that bring it out. Obviously drugs and pregnancy, thyroid problems, other endocrine problems, stress, which causes internal inflammation. And then of course there's chronic diseases that include metabolic syndrome and diabetes type 2, drugs, chemicals, nutritional deficiency and cancer.
So can it be mistaken for anything else?
Yes, it can. So if you go to a place and they just look at your pigmentation and they say, yes, we'll give you this treatment, what you've got to be careful of is that it isn't something more serious like autoimmune diseases, like cancer, like internal inflammation. And that's why I think people should probably prefer to go to a medical type cosmetic clinic, so that if you're going to see a doctor, that the doctor doesn't think, that looks a bit unusual, I might look into it.
So what is the treatment, Frances? Please tell me that I can do something about it.
Well, obviously looking after the inside and picking up any vitamin, mineral or hormone deficiencies, treating any thyroid problem, chronic diseases and stress. And so sometimes giving vitamins and minerals and even stress herbs can be helpful. After that, it's not a skin treatment. After that, it's sunblock, 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 definitely. And then as part of your skincare, and before I forget, during the winter as well, the sunblock. And then as part of your skincare, there are pigment blocker creams, and there are creams that stop, lighten up the skin. There are creams that are vitamin A and vitamin C derived as well. Then, only then, when you've got all of that under control, can you progress to an actual treatment in the clinic. Now, many clinics have an intense pulse light, but unfortunately, that is designed for skin types that are lighter than mine, and maybe you'll get away with doing it on my skin, right? So you can see that IPL is not well suited to the darker skin types that tend to get this problem. So you'll often be presented with other treatments that don't worry about your skin type, which include a cold laser called laser genesis. There's no pain or downtime with that. Skin needling needs to be done very carefully so that it doesn't flare you up, and you can add platelet-rich plasma to that. There is a treatment called hydrofacial, no downtime. Now there's a very new type of laser that has no downtime and is comfortable, called a picosecond laser. Now this is the newer kid on the block. And of course, we've still got fractionated lasers, but I think you've got to be careful with your skin color. And then combinations.
What about taking drugs or other medications internally? Can we take a pill and will that be helpful?
Well, actually you can, believe it or not, because I think omega-3 fish oil is going to reduce inflammation. So is vitamin C. And then we've already said correct a few things, but I've done some research to update my knowledge. Well, guess what? Oral or melatonin on the skin reduces pigmentation. So you can get your melatonin from your GP. Also, oral or on the skin, something called glutathione, which is your master antioxidant. But probably what's more convenient than getting glutathione is to take a supplement that turns into glutathione called N-acetylcysteine, or NAC. Now that's cheap and readily available. But also you've got one main drug which has been researched quite a lot on its own and in combination with treatments, and that's tranexamic acid, which is also used for heavy painful periods. So that's very good.
So plenty of options then. I don't have to live with the brown spots on my nose and my forehead. I just should have worn more hats and sun cream when I was younger, and maybe my 3 pregnancies didn't help either. Frances, any final words of advice?
Well, look, I think it's really important to make sure you see a medical person so that nothing important's missed.
Yeah, that is great advice. Thank you so much, Dr. Frances. Nice to see you.
Lovely to see you too, Carly.
And if you are concerned about anything we have discussed, please contact your own healthcare professional. And to find out more, visit Dr. Frances's clinic at skinfresh.co.nz.